We now have Quezon City Mayor Joy Belmonte over the phone. We will be asking her on how this possible or talks of a lockdown could possibly affect things here in Metro Manila. Mayor, is it true that there is a doctor in Quezon City that has tested positive for the virus? Can we confirm this first? At least with Quezon City, how many cases do you have at the moment?
Hello. Actually, we have a doctor, but he doesn't work in the Quezon City government. He lives in Quezon City, in Barangay Mataldang Balara, and he is a resident at Makati Med. So he acquired the disease while attending to a patient in Makati Med.
All right, Mayor, could you give us the latest on the ground? What other details are we receiving as regards patients under investigation or maybe confirmed cases?
Well, in terms of confirmed cases, we have in Quezon City 6 confirmed cases already. So we have the first one is a 57-year-old retiree, and we've done contact tracing on him already. The second one is about a 32 or 34-year-old sales manager for a private corporation, and he has history of travels abroad. The third one is a doctor as well. He's a specialist in, I think, pulmonary medicine, but I'm not that sure. And he has had he has clinics in various hospitals, and he comes from Project 6 in Quezon City. So we've started doing contact tracing on him. The work side is a little tricky because we have to go find out who his patients are, and etc. But the personal side, we've managed to work on that already. The fourth is the doctor I mentioned to you about, who's 27 years old. And the fifth one is a 26-year-old male who works for a multinational corporation. And he was just diagnosed, I think, early this morning. And the sixth, I just found out about a few minutes ago, and she's a lady in her 60s, and so far there are not many details I have about her yet. So six in total.
That's right, Mayor. Understood. But at this point in time, we're seeing a big rise, a big jump in cases. Yesterday, we talked to San Juan Mayor Francis Zamora. However, in Quezon City, it is so big and so vast, so many barangays there. How is it going for you guys at the barangay level? What is the protocol of QC when it comes to somebody not feeling well? Does it go up through the barangay system to the barangay captain and then to the, how does it work? And also, how many testing centers do you have in QC since it's such a big city? And of course, I think what people really want to know, as President Duterte announced, will PhilHealth be picking up the tab of all these testing, fees?
Well,
yeah.
I would like to know the same thing. But in the meantime, so, I think that's something that can be settled later. The important thing is that the logistics are in place, so we can provide for the needs of our people right away. So what we're doing is like you said, our city is vast. We have 142 barangays. We have about 3 million people. So we really need the help of the barangays. So our barangays are trained. We have something called the Barangay Health and Emergency Response Teams, and every barangay has that. They have their own ambulance, and they are trained already. So persons who are feeling ill can go to the barangay and get advice or get some kind of assessment, I think. They can go to their health centers. The health workers in our health centers are also trained. They can call hotline 122, because our call center agents will give them advice with regards to probably the nearest hospitals or health centers that they can go to. We also have 3 locally managed hospitals, and they can go to any of those 3 hospitals. And of course, we have countless private hospitals, and so if they can afford it, they can go to these private hospitals. Now, I'd like to make it clear that there is really only one place where tests can be validated, and this is the RITM. So while they can go for testing in our hospitals, they can go get swabbed, and these samples will still get sent to the RITM. So we're waiting for the approval of the DOH of the UP testing kits, because once that is approved, then we will have more. I think that the testing can be decentralized to the city level already.
Right, Mayor, I'd like to ask you about class and or work suspensions. What is the stand of the Quezon City local government? Are you considering maybe a work from home scheme or perhaps extending the suspension of classes past March 14?
Yes, definitely. That is on the table. Now we at the moment are complying with the suspension order of our president. We are making sure our children are staying at home because the Department of Education has given them work to do from their homes. We are ensuring that kids that are going to malls are prohibited from entering. We have worked with the police and requested the police to watch out for any kids that are loitering in the streets, and that these kids be brought home to their parents. No. Now, with regard to extending the suspension, that is very much on the table, and it really depends on how things unfold in the next couple of days. But certainly, we're open to that. The Civil Service Commission has already put out some kind of a memorandum recommending a 4-day work week, and we are working on that now, the mechanics of that, and hopefully I can implement that as early as tomorrow or if not by Monday. So those are all very much in the books. I also have a policy now wherein if an employee is probably a little elderly with a low immune system, I will ask them to be excused from coming to work. And then we're also going to be disinfecting the entire City Hall complex this weekend. We are disinfecting our schools as we speak. And I'm now drawing up a schedule to disinfect all of our public buildings here in City Hall. And I'm requesting the private sector to do the same.
All right, sounds like a working weekend for you, Mayor Joy Belmonte of Quezon City. Again, for all QC residents, Mayor Joy, right? Just dial 122 for any concerns, and the call center of Quezon City will be ready with answers for you.
Yes, ma'am. Yes, ma'am. Thank you very much.
Thank you, Mayor.